Welcome back.
Hi again.
Hi.
I'm so excited to hear part 2 of Addie's story.
What are we doing? Are we doing the second part of She Can't Do That?
But she did it anyway.
Yay.
What did she do anyway?
Open her freaking own practice.
I know. I want to go to her practice.
I know, right? It's like, if I not only I already have a therapist.
I know. I went to school, clinical psychologist now, own practice. Let's hear how she got there.
Let's do it.
Let's go.
I also felt that my brain wasn't working at that time.
That's true.
I did my real estate license when I think my daughter was a year old or something. And it was so hard to study, to remember things. I was just constantly thinking, like, what is wrong with me? Like, I don't have the brain capacity right now to do this. Like, when you have a baby, it's not that you're sleep deprived and your hormones are crazy and all these things. Maybe you have postpartum, but also I felt like my brain is not where it used to be. Did you feel the same thing? I mean,
yes.
Like with the 3-month-old?
Yes, 100%. So now, not only that this is a second language, but now I'm adding another burden, which is basically to be present while, I mean, your head is somewhere else and your body is somewhere else, and you're going through all of that, and you're going through all of that for the first time, right? So now I have 3 kids, but I know that this transition of just being who you are and then becoming a mother is such. I mean, this is the most difficult transition in life, I think. It's beautiful and it's amazing and it's rewarding so much. But let's face it, it's also motherhood is not just butterflies and rainbows.
Nope.
And to deal with that while also being in school and while also trying to promote yourself as a person. And, you want to continue what you want to achieve and your goals and everything, but you are also a mother now. So you also have someone else that you need to take care of. And you have to be 100% in both ways, right? That you have to be there. So that was very difficult. Yeah.
Did you deal with postpartum?
I don't think that I did. But I think that it's important to note that that there are differences between postpartum blues, I mean the baby blues, and the significant, symptoms of postpartum anxiety and depression, right? So 80% of women will experience what we call the baby blues. So for the first 3-4 weeks of a baby's life, you have all your hormones, right, as a mother, and you have all these changes in your body, and so it's very normal to feel very sad. Right. And to have really these roller coasters of emotions and to cry a lot and to feel. And I really remember those moments where I had my baby in my hands and I told myself, what did I do? Like, why did I do it to myself?
Oh my God, I remember
what am I
that
doing
too.
here? Right. And I think it's important for every woman, every mother to know that this is normal. And this is, again, 80% of women feel this way, right? So, and I think that it's also important to know that if you don't have social support, and the knowledge and the ability to overcome those first few weeks, these symptoms can definitely prolong and get more severe, and that's where we see more of those significant symptoms of anxiety and depression. Now, I also want to say that people really focus when they say postpartum. The one thing that comes to mind, I think, in society nowadays is postpartum equals depression. But actually, postpartum can be anxiety. And I don't think that is talked about as much, because when we think about, this woman has postpartum, we think she cannot, maybe we know that she cannot really relate to the baby. Maybe she's feeling sad. Maybe she cannot really, helping herself and she cannot get up from bed and all of those things. But actually, let's also think about the postpartum anxiety. And postpartum anxiety is when you as a mother, you feel too scared to walk with your baby, to go down the stairs with your baby because you're afraid that the baby might fall from your hands. And you might feel scared to drive with the baby, to put the baby in a car seat and to drive by yourself because God forbid something bad would happen. And now you are looking at the monitor again and again and again to make sure that the baby is breathing, to make sure that the baby is okay. You're doing everything in your power to make sure that the baby is not crying, right? Don't put him down. Don't do those things because what if it's not okay? What if it's not right? All of those what if and all of these worries. I think that in our society, kind of we think that this is normal. We think that this is okay, but this is actually an extreme case. We don't need to be that. It's not okay. It's not normal. Okay. So if, and that's something that I definitely want people out there to hear. If you do experience those symptoms, this is postpartum anxiety. And so there are ways to work on that. There are ways to deal with it because a mother doesn't need to feel this constant worry that the baby is not okay, that the baby is not okay in her hands, the baby is not okay in other people's hands, to not trust other people with your baby. So yeah.
Oh my God, I wish I would have known you when
Me
I had
too.
my child. I didn't have anybody telling me that when I had my child. And the thing is, you come home from the hospital and they give you this list of things to look out for. Like if the mother has a fever of 105, call the doctor. If the baby turns blue, call the doctor. And then there's one note on it that says, if the mother refuses to care for the baby, seek help. If you don't show interest in caring for your baby as the mother, that's not normal. That shouldn't be. Then you should get help. But I never had that. I never had...
That's extreme. That's very extreme.
Yeah, I never had the situation where it was I don't want to care for her. So I was like, well, this means postpartum. And what I have is not postpartum because I don't have the feeling that I don't want to care for her. I care for her. I do everything in my power to help that she's not crying and that she's fed and that she's feeling well. But I had this anxiety that you were just explaining. And I had this moment, I had this thing. I always said, I love this child, but I hate motherhood. If I could have paid somebody to make this go away, not kill my baby.
No, I get it.
That's not what I'm saying. But if I could have paid somebody to go back in time and make a different decision, I would have in a heartbeat made that decision. I don't want this child because it was too much. It's I can't do this. And also I'm not feeling all these feelings that people were telling me about. Exactly. Everybody was just pregnancy is the most amazing time in your life. And then you're in the hospital and you give birth and it's so magical. And you have this child when you finally get this child on your chest, you're going to feel the luckiest in your life ever. And I didn't feel that. I went through this traumatic birth, and then I had this baby on my chest, and I was just what the heck did just happen to me? I feel like I just died for 40 hours, and now there's this thing that I need to take care of, and I felt nothing towards this baby. And of course, because I didn't talk about it with anybody before, nobody like you told me this can happen. No doctor, nobody told me be prepared that this is possible, that this happens. I thought it's that's me. I'm just a bad person. There's something very, very wrong with me that I'm not feeling these feelings that I'm supposed to feel. I'm not the happiest in the world and I'm not having this, oh my God, this is so magical. I just didn't feel that. And it's okay, what a bad person are you?
Exactly.
You're a failure.
Exactly. Then you blame yourself.
Yeah.
Then you see, because the thing is that I think that especially before the pandemic, and I think that something shifted there. But the societal pressure to be this amazing mom and to always think that 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 being a mother is amazing. And it's just all, again, the butterflies and rainbows and like all the good things about being a mother. And like, this is what we're supposed to do. We're supposed to be mothers. We are born for it. This is, we have to do it. We have to love their child. We never talked about like the downside of it. We never talked about just like how reality is. And reality is that, you can love your job and you can vent all day long. And what's the big deal, right? And you can love your husband, but you can also gossip and talk about him behind your back and say like, oh, I hate this about him and I hate that. And that's normal, right? Why can't we just talk about it with our friends, with society about motherhood this way? Why can't that be normal too? Mm-hmm. Why do I have this thing that when I talk to friends that are mothers, they have to say, oh my God, my kid just killed me today. It was so terrible, but I love him to death. Why? Why do you need to say the but I love him, but I want to show that I still like, of course I love my kid. But why do you need to say that?
Mm-hmm. That's exactly what I just did too. Mm-hmm. Like, of course, I'm gonna make sure. Like, of course, I love my child. Nobody questioned that. Like, of course, I love my child. Yes, totally.
Yeah. So this is our guilt. This is our pressure that we have to always finish with this like amazing note, right? And let's talk about breastfeeding. Let's talk about this, like, this experience of breastfeeding. Some people like it. Some people don't. Mm-hmm. But there's so much pressure to breastfeed nowadays. And, it starts in the hospital. It starts with just like, bringing a consultant to help you and bringing someone to help you and keep talking about like how you'll overcome this problem of like, this is hurting so much and I don't like it and I don't feel good about it, but you overcome it. Don't worry. It's going to be okay. It's going to be fine. You're going to be amazing because you have to do it.
And 1 million people did it before you.
Yeah.
Oh my gosh.
Everybody did it. It's the most natural thing.
Yeah.
So
all the things we're told.
Shame on you if you don't like that.
Exactly. Mm-hmm. Exactly. And also shame on you if you don't do that. Shame on you if you can't.
Yeah.
Shame on you if like something, if you have a problem with that and you have to stop. And really? Like, are you using formula? Which formula are you using?
Right.
Right? Are you using all the like really good stuff that they brought from Europe because the United States is not exactly the standard? Or do you use the brand name that, everybody uses? That's bad. Mm-hmm. Like, why are you doing that? Why do we also as mothers, we guilt, like we put ourselves in this like guilt and shame all the time. Like, why do we turn to each other and we're like,
that
you couldn't do that.
Stop. That needs to change.
Right?
Yeah.
So I think that all of that is leading to feeling even more lonely in this experience, in this like, again, such a transformational period in your life that you don't really know what's happening. And now you can't even talk about it. You can't even talk about the bad experiences that you're having. When you're talking about motherhood, you always have to glorify it as if it's like the best thing in the world. But hey, it's not. Like, let's face it, it's not.
No, it's not. And it's all on the mother again. It's the difference with fathers and mothers is so intense. It's like, are you going back to work or are you staying home? Do you have a nanny or do it all yourself? Like, this is all on the mothers. Nobody asks my husband, are you going back to work after you have a baby? Of course you do.
Yeah.
Like, that's not even a question. Like, they don't ask him like, oh, you be away over the weekend for your job? Who's with your baby?
With your babe? Exactly.
Like, nobody ever asked that my husband. Exactly. If I would say, oh, I'm going to go for my work for a weekend, like, what? I thought you have a baby. Who's with your child?
Yeah, as if like there's no father and he's not like 50% of,
Even if the child would be with grandparents or with the nanny or whatever, the mom gets the guilt.
Exactly. And, I remember that I told my husband, like, basically, when I became a mother, I became someone else. When he became a father, he continued to be himself.
Yeah.
Nothing changed.
Yeah.
He just like had one more thing in his life.
Yeah.
Right? For us, everything changes.
Yeah.
everything changed.
Do you work with mothers in your practice too?
So I do. I work with, my specialty is children and families, and they usually come to me a little bit older. But I love parenting, and I love working with just that experience of being a parent and loving your child, but also to have very difficult time with them, and how to deal with that, and how to navigate through life with, as being parents.
I think it's so important that we talk about it, and we can't talk about it enough, about the different ways that women experience in these like very important years of becoming a mother and having a child. And there are so many different ways to do it, and there's so many ways to experience it. And what you said earlier, we as women are so judgmental with each other.
Yeah.
We can't blame men for this. That's not really what men do to us. It's almost more that women do this to each other.
Mm-hmm.
The breastfeeding and the like, whatever. Are you going back to work? Are you having a nanny? Are you doing this? Are you doing this? And we always need to think about that everybody does what they think is best for them and for their situation. Nobody, if you're not a psychopath, you're not doing something with the knowledge, oh, this is bad for my child, so I'm going to not breastfeed. That's not going to happen.
Yeah.
It's like I can do whatever I can do. And if I can't, then I have to find a different way. But every mother I know has like the best interest in mind for their child.
Exactly. And also, like, it's not even about if you can or cannot. It's what you choose. You can choose things.
Yeah.
It's exactly the way, again, why in every different aspect of life, career, the way that you do your laundry, the way that you do everything, your hobbies, your relationships, everything else in life, you can choose, you can decide, you can do whatever feels good to you, and there's no judgment about it. But in motherhood, there's only like one way to do it, and if it doesn't really look good, then it's not okay. Right. And so my dissertation was about this the first 6 months of being a first-time mom. And I had the privilege of having 500 women answer my questionnaires, which actually it was very surprising to me, but I was able to recruit them in 3 days.
Wow.
3 days.
500 women?
Wow. 500 women. And I actually had more than that, but I was able, like the ones that actually answered everything that I was able to keep was 500 women.
Wow.
I think it was first, I promoted those, my research on Facebook. So going back to the Facebook thing, I think that there is a huge need of mothers to talk.
And
to
connect.
Vent, to connect, to to say what their experience is like. And it was during COVID. So I think that this isolation of we can't connect, we can't come close and just be with someone else that we like and talk to them. So people were looking for a place to just release these feelings and to talk about everything. And so I had them answer many questionnaires. And I wanted to take a look at just the correlation between how expressive they are with their emotions, if they talk about all the emotions. And I focused on the negative emotions. If you vent, if you talk about these hard things about being a mother, and how does that correlate to your well-being and your, satisfaction in life? How do you feel good about yourself? And so, and I saw that, yes, it was true what I was thinking. Basically, when you share your negative emotions, when you talk about the reality, which again, it's not just purified and amazing, it's also pretty bad. And that's okay. When you talk about it and you share it with other people and you have the support from other people that they can listen and you can, tell them, hey, I need help. Hey, I'm not feeling great. Hey, this has been a hard day for me. And I want your support to just listen to me. You experience better, just higher higher well-being and higher quality of life, basically. And your postpartum anxiety and depression symptoms decrease. So just by talking about those negative emotions, you can decrease your postpartum anxiety, depression.
So what advice would you give young new mothers? Like, just build a group, have somebody, get a therapist, like what?
So I think that first of all, be aware that not all emotions are positive with motherhood. It's okay. And it's okay that you don't bond with your child the moment you see them. And it's okay that you don't like it. And it's okay that, you don't want to breastfeed. And it's okay that you don't know what to do with a baby. It's okay, right? Like, you were not born with it, and no one was born with it, and we all struggle. And knowing that it's normal and just normalize everything that you experience, the good and the bad, just by itself would help you, right? I definitely recommend being in a group. So if you have the ability to join those amazing, there's amazing club or whatever. It's the Fit for Mom. If you know it, it's so good. They have it in Santa Monica, West LA, and Los Angeles, and just like a group of women coming with their stroller to work out. And I love that as a first-time mother, because you can see other people. You can see other people struggling with the same things. You can see other people trying to work out while the baby is crying, and now the mom needs to stop and feed, and everyone thinks it's normal because we all experience that. So just on itself, that is normalizing. Just seeing someone else in the same boat as you is helping, and it's very helpful. And yes, if you do experience what I just said before about those symptoms, read more about it and seek help, because people can help you. It's I don't know if people understand that therapy can be very temporary, right? Therapy can be just for a few sessions or for a few months. And the idea, especially the therapy that I provide, the idea is to give you all the tools and all the skills so you can continue by yourself. That tomorrow you're going to face something different but similar, you will know what to do then, right? You will have the skills that you can deal with it alone. So look at it as a good investment for yourself.
Yeah, a lot of times people are not able to do it because it's expensive.
Exactly.
But that's a good advice that you say you don't have to go into it. It's like, oh my God, I have to spend this amount of money for like every week for like the next 10 years or something. Maybe just invest in a few sessions. And it's a very, very important investment. I would say, like, I wish I would have invested.
How amazing would it be if that was just a service of care that was provided for women leaving the hospital?
Yeah.
Like, you're going to go home with this baby, but I'm going to see you in 5 days for an hour. There's going to be somebody here taking care of your baby. And for an hour, you get to just talk to me, tell me your experience of the last 5 days, tell me what you're feeling, ask me questions. I mean, I feel like we get more instructions leaving at the grocery store with a turkey to make for Thanksgiving dinner.
Right. That's correct.
Than we do for how to not only care for a child, but also how to care for ourselves after having a child. And there isn't that care given.
And I feel like taking care of ourselves is completely lost.
Yeah.
Like, it's a little bit like, how do you swaddle and how do you feed? Like, they told me I have to wake her up every 2 hours and breastfeed her, even if she's sleeping. My mom was just shaking her head, just like, why would you wake a sleeping baby? But at some point, some baby probably starved to death while it was sleeping. And since that day, they have to tell you to wake it up and feed it, even though she's well fed and she's not underweight or whatever.
Yeah.
I trained my baby very well to wake up every 2 hours. Well, thank you for that, because that kept going for years.
Oh my gosh.
Then you have to deal with training back.
Yes, exactly. But that's what they tell you. They don't say anything about the mother. And again, if I compare that with my mom having children, my mom has three children. First of all, she was in the hospital for like a week or 10 days. And they made sure the breastfeeding worked if she wanted to. They made sure that she healed fine. They made sure she's mentally okay. They took the baby at night in the nursery so she could sleep.
Mm-hmm. This was in Germany?
This was in Germany. And they're not doing that extreme anymore in Germany either. Mm-hmm. That changed over the years too. But now they do this like skin on skin. And I feel like there's a lot of benefit to do the skin on skin, but you completely forget the benefit, the well-being of the mother. Mm-hmm. Like you go through this birth of like, I don't know, 10 hours, 20 hours, 40 hours, whatever. It's a very intense and sometimes very traumatic experience to birth a baby.
Yeah.
Then they put it on your naked body. The skin on skin thing is great and good, but then you have this child from there on and you don't get a break. Like you need to rest. Yes. You need to get like your head straight after what just happened to you. Mm-hmm. It's like you just almost died. You had the most pain that you ever experienced in your life, the most fear, and that for like 30 hours. Mm-hmm. And that's just like, okay, and here's this child, and now feed this every 2 hours.
Exactly. And now from this day on, you will come second to this child.
Yeah. Mm-hmm. And I feel like I haven't recovered from giving birth yet. And my daughter's going to turn 10 in 2 weeks. So it's just like, yeah. So all the attachment and everything, that's a great thought. But we have to think about a little bit case by case also. Mm-hmm. For me, it would have been maybe better to have the child in the nursery for 10 hours and maybe give her formula or whatever and let me rest. Yeah. Mm-hmm. And then start with a little bit of energy and not like completely exhausted and in fear and in panic. And now I have to take care of this thing and I don't even know what I'm doing. And tomorrow they're going to send me home with it. Yeah. And my husband goes back to work and, what? Like, what am I doing? I can't even walk yet because there was some injury happening. Mm-hmm. And the mom is completely secondary.
Exactly. No, I agree. I think that also for many, many women, this is the first time ever that they are, going through something very difficult in a hospital, right? So many women did not experience any surgeries or something like that prior to that. And now this is your first time having something very difficult happen to your body that changes everything in the way that you hold yourself. I completely remember the first time that I had to pee after giving birth for the first time. Right? I'm sure that this is an experience that everyone could relate to. I mean, if you give birth. But I remember that my baby cried a lot and I needed to get up from the bed. And I actually I needed to pee, but I didn't even realize. And I got up to pick up the baby. But since like everything was not working correctly in my body, I think that I peed on myself and I was in so much shame because again, I never experienced that. Mm-hmm. Up until now, I had full control over my body. Mm-hmm. I never had a problem, thank God, right, with my body. And I knew that I'm, that this is me. And I just felt like so vulnerable, like so miserable, right? Like it's in so many ways. But again, it's not about me anymore. Mm-hmm. It's just not about me anymore. And this mentality, this feeling, and it's just this awareness that now you have someone else with you, that first of all, you need to take care of them. Mm-hmm. Yeah. So yeah. That's being a mother. But I think that again, like you can look at it from many angles and you can look at it from many perspectives. But this is the idea of like if we're going back to the idea of this podcast of you can't do that. So luckily we can. Mm-hmm. We can be mothers and we can, have a profession and we can do everything together and we can feel guilty about things, but we can also, we do need to learn to give the best that we can, to do the best that we can, because we can.
And don't do it alone.
Mm-hmm. Don't do it alone. And have grace for everybody's journey. Everybody's different. We don't need to wear like a badge of honor and say, like, I remember my mom growing up was very proud of herself for birthing naturally 4 children and not having an epidural for a single one.
Oh my God.
And so when I was getting ready to become a mom, she asked me what my plan was. And I felt shame saying that I would be fine with having an epidural because she wore it like a badge of honor. And I mean, she should. That's an incredible feat, but it's not an expectation that a mother needs to naturally birth children without having an epidural. We just need to learn to have more grace for each other and not pass judgment and hold space for each other, because every experience with motherhood is different.
And every birthing experience is different. For some people, it might be doable without an epidural. For others, it's not. Others need C-sections. Oh my God, the guilt that people feel about C-sections.
Yeah.
Like, I wasn't able to birth naturally. What the heck? Like, if I break my leg, I go to the doctor and get a cast. Like, I'm not able to heal this naturally.
Right.
Like, I'm not blaming myself for needing medical health in a specific situation. But with motherhood, again, like all this shame and this blame, like we're all doing the best we can. If the best is to have a C-section for the child and the mother, thank you that we have this option. Like, hundreds of years ago, the woman would have just died, or the baby would have just died, or both of them.
Yep.
So we have these opportunities to use these medicine, like these achievements we have in medicine. So just stop shaming people.
And I think so that is why it's also important to come with an open mind. If you are about to give birth, come with an open mind. Don't have a set plan for how you think that it's going to go, because guess what? It might not. And I think that when you're very set on like what you want and how do you want it to look, and you have a vision in your mind, it can be devastating to experience something differently. But if you have this just like open mind to, I don't know how this is going to go, and I'm just going to understand that life is unpredictable, and I just have to embrace the unknown. Then you're going to be more open to whatever is going to happen here. And hopefully this is it will end with a beautiful birth story, but sometimes it's not. And you know what? So what? Let's move on.
They kept asking me before I gave birth, like, do you have a birth plan? And I never knew what they were talking about. Like, what do you mean? I'm going to go to the hospital and I'm going to push this baby out. Like, you got to write your birth plan. You got to give this to the nurses and the doctors. I was like, what am I supposed to write on this? Like, having a child? Like, what am I, like, what kind of candles you want and what kind of music you want, and if you want an epidural or not, and if you want a C-section, or it's like, I can't plan this. I got to quote Kristen Bell again. It's like twice in one episode, but she said that too once. She's like, and then you write this magical birth story, what you want it to be, and then you take this birth story and then you rip it in pieces.
Exactly.
Because it's not going to be like that, and it might, but it might not. And if it's not, then you feel shame again.
Yes.
Already, are we starting like this? So
exactly.
You make this plan, and then you maybe have to pivot and do something different because that's what the situation asks for. And then you already feel shame, like starting with the epidural.
Yeah.
I tried so hard to do it without an epidural because I had somebody that I knew at the time who did it naturally too. And she was very, very proud of it. And she kept telling me, you have to do it naturally. You have to do it naturally. Also, if you get an epidural, that's going to lead to a C-section. That's all that they want in the hospital. And I never really understood what she meant with that. But I felt like I had to do it naturally. That's just what you do. Otherwise, you're a freaking loser. And then the pain, at some point, I was just like, I remember I said, like, okay, if I'm kind of like there in like an hour or two, I think I can deal with this level of pain. And the nurse looked at me and was like, it's more going to be like 8 hours or 10.
Exactly.
And I'm like, then I think I can't.
Maybe not.
I think I can't do this for 8 or 10 hours. In the end, it was like more like 15 more hours. So I was like, is it still possible to get this epidural? And she's like, yeah, we're close at the point where it's not going to be possible anymore. But if you can sit still for a minute, we can still do it. And I'm just like, okay, please give me this epidural. I can't do this anymore. Like,
Yeah.
And I felt such a loser.
Oh, really?
Yes.
No way.
I felt so good. Yeah,
I thought
say
that you felt so good.
Of course, I felt so good. And that's what my doctor actually said too. The epidural is not just to get rid of the pain, but it's also to give you a break.
Yes.
Now you can rest a little bit because you're going to have to work when you like push and things.
Yeah.
But you're not going to push for the next 8 hours. But you have a little bit of a break for the next 8 hours from this pain. Otherwise, you're going to be so exhausted that you're not even going to be able to push anything anymore out because you're so exhausted. So see this as a break. But that's what my doctor told me before because, of course, my gynecologist, she always said, okay, Sarah, you can have your baby whenever you want, but don't have it during these 3 days because I'm going to be out of the country.
Oh, no.
Guess what? I started labor just when she left the country. I started going into labor and she was not there. So I gave birth without her. And I had this other doctor, which was a man, which I didn't really like. And which I've never met before. And I didn't know him and I didn't feel like he was very patient with me. But I remember her saying that about the epidural. It's like also to give you a break from the pain and like keep you a little bit from being too exhausted to like do all the other things. And
That's
also
great coaching.
Yeah. Also, after you're done with the pushing, you're going to have a baby that you need to take care for. You're not going to get a break for the next 5 years.
Exactly.
So
exactly.
And buckle up.
I love that you talked about this break, and it made me think about just in therapy now. So as I said before, I usually see parents of older kids, and older kids I mean 2 and up, but just not the baby ones. And the one thing that I talk to them a lot is just to give yourself the opportunity to be this to plan to be a lazy parent. Okay, give yourself this opportunity to just lay back and to take a break and to sit on a couch and see if your kids can do things without you, right? Because when I think about it, of like, you mentioned that, and again, you have this, it's really interesting. So you have this societal pressure on one end of you can do it all with no epidural, you can do everything. I did it, you do it, and all of those things. Yes, we can do it all. We can take our kids to like 500 activities over a weekend, and we can show it off to everybody else. But do we enjoy it? Did we give ourselves a break? Did we take the epidural and kind of like felt good for a second for ourselves without looking at the outside world and all of that? So if we are thinking about even like motherhood in when the kids are a little bit older, I think that nowadays, and I actually heard this amazing podcast talking about it as well. I think that we got to a point where we are doing too much for our kids, right? We got to a point where we are, they talk about the helicopter parenting and all of that, but even in this case, like I'm just saying, like even when you are helping your child do things that they can do it themselves, you are depriving them of having the opportunity to actually, develop in the best way, to actually get to a point where they can do it, right? And so now we learned from all the, societal pressure and expert and everybody else that, hey, when your child watches TV, you need to sit there, pause, and and work, and ask them questions about it and educate them. Every moment should be educational. Every opportunity you have to find a way to help your child learn from it. And I say, wait a second, let's take a step back and give the child the opportunity to just be bored. Right? Give the child the opportunity to try things themselves. Don't get up from the couch. Be lazy, right? sit there, enjoy your time, enjoy your coffee. You can scroll on social media. Yes, I'm a psychologist and I'm giving you the permission to do that as well. Because I want, first of all, to lower the pressure that we have on ourselves as parents even now, right? Like even when the child is a little bit older. I want to lower that pressure, and I also want to give the opportunity for the child to go get themselves a cup of water.
I know. What do you always say, Taryn? We have to raise our children how?
I love this conversation. My philosophy was informed by a boyfriend I had, actually. And he said, our job as parents is to make ourselves obsolete. Mm-hmm. We're working ourselves out of a job. And I love that take on it, because my job as a parent is to prepare my child for life.
Yeah.
I have 18 years until she goes off to college and lives on her own. So I have to teach her everything about survival, independence, listening to her intuition, how to choose right from wrong, how to be responsible, how to, deal with money, how to formulate a resume. I mean, I have so much that I have to teach her in 18 years. And I totally subscribe to let them figure it out. Mm-hmm. Because, my daughter is going to be 8 next week. And I started, in the old days when we would go to the airport, I would dictate where we would go. And then listening to that perspective, now we go to the airport. I'm like, okay, so where are we going? Mm-hmm. And she has to figure out, okay, we have to go to this line at TSA and this is our gate. But first we should get water in our water bottles and we should go to the bathroom, and she has to find our seats. So she's very, she's learning life. And I feel like that is kind of my mantra. But I totally subscribe to, like, she gets her own water. She made her own lunch this morning for school. And I'm not a bad mom because I didn't make her lunch for her and pack her snacks. I am trying to teach her like this other way of how to be responsible for herself.
And that may also mean that lunch is not going to be as pretty and as like cool as those like things that we see on social media, right? Because look at what we're trying to convey on social media. Look at me making this like bento box with like all these cuties and like all these amazing things, and with protein and this and like macros and all of those things to my child, and only natural ingredients and all of those things. But then, okay, first of all, as I know kids, most of them will come back with like, most of it still there. They didn't eat all the vegetables and all the, like, so what are we showing on social media? Why are we showing that if it's not the reality?
Right.
Right?
They didn't eat the carrots that were cut in the shape of hearts. Like they don't care. It doesn't make them taste better.
Exactly. And they don't like it. So let's just, I'm not saying let's not work on having our kids eat vegetables and fruit, but let's not also put it on social media as if like this is how the kids like it. So I rather them, I also do that, by the way. I also give my kids a chance sometimes they're younger. So sometimes I give their chance of like, go and make your own snack, go grab, go do, get this, Ziploc and find something that is there. And I tell them, because exactly what you're saying, I want to lead them, but I want them to do it. So if it's important to me that they will have some protein and some carb and some veggie or things, so then I say, okay, open the fridge, find something that is dairy. Right? Open, the cabinet, find something that, that will fulfill you because it has this and this and that. Open, choose one fruit or veggie that you're going to eat at the snack. And now we're giving them a little bit of freedom to choose while we're guiding them, right? Where we give them some of like those boundaries and this is the box. So I'm not saying go ahead and pick chips and fries and whatever, and donut and chips and go. I want my kid to choose wisely. I want my kid to know what they consume, but I'm going to let them choose it. I'm going to give them the opportunity to do that.
And it starts earlier. You just said, Taryn, like, I have 18 years to prepare my kid. That's like the complete independence then, when they maybe go to college when they're 18 or whatever, and then they have to really live on their own. But it's also so much earlier where they go out in the world when they just go to preschool or when they go to school.
Right.
Like, if you have every discussion for them, which maybe might be on the playground or something, and they come to you and say, oh, Mom, this kid was mean to me. And you go up and walk to the kid and say, hey, don't be mean to my daughter.
What did you do? Yeah.
Then she's not able to do that for herself when she goes to school and somebody's mean, because I'm not there.
Right.
So we got to teach them so early to do this. And I'm doing this with my daughter right now, and she's almost 10, and she has a very hard time to speak up for herself. And that's a very important thing for me right now in our relationship, because I can totally relate to that, because I had a very hard time speaking up for myself for years and years and years, and people like trampled all over me because I didn't speak up for myself. And I tell her, like, I'm so much older. I'm 46 years old, and I'm like still learning to speak up for myself. I don't want you to need that much time. I want you to practice it now. So she comes to me and said, like, yeah, but this happened and this happened and this. And I'm like, and now you're going to go back and you're going to tell that person exactly what you told me. It's like, it's not helping when you tell me what this kid, you need to tell this child, I didn't like that. And you don't need to yell, don't need to get in a fight, but you need to stand up for yourself and say, hey, I didn't think that was fair. I didn't think that was kind. Can we do it differently? Or I would prefer this and this. It's so hard for her. But that already starts in like school. She goes to school for 6 hours every day where she has to stand up for herself. So I have to prepare her to do things without me.
Yep. Yeah, you're right.
And of course, we want to help them and we want to do everything for them. And when we see they're in trouble on the playground, we want to go over there and like push that other kid off the swing and say, you don't be mean to my child or what. But that's not helpful. Yeah. And that doesn't mean you're a bad mother, again, because you're not helping your child. That's actually the opposite. You are helping your child the best way you can. And I have to learn that because, of course, I want to nurture my child. When she comes to me and cries over something that happened, of course, I want to go over and fix it for her.
100%. You want to go have the conversation with the kid that stole the toy and do everything, to solve it. But that doesn't help her.
No, they don't know how to do it. And you can't be there 24/7, and you won't.
And even like on like smaller things at home where the kids are like, oh, I can't do it. Oh, I can't, dress myself out, or I can't take a shower by myself, or I can't, open this bag of chips, whatever, like all of these things. We feel that it's our obligation to go and help them. We feel that this is the right thing to do, but actually lay back, sit on your chair and talk to them. Talk them out of it. Like, right? Like, hey, here's a bag of chips. I can't do it. Okay, so you see this thing. Do you see the little part? Push on that. Pull it. Do whatever. This is a lot more helpful. This is exactly what you said with your daughter. Let me guide you. Let me tell you. Let's even role play what you're going to say back to this kid that was mean to you. But I'm going to be there in the back and I'm going to help you when you don't know what to do. So don't worry. You can always lean on me. You can always come back, but I'm not going to do it for you.
It takes a lot of our patience, though, when they're like toddlers and they want to do it themselves and they can't figure out how to close that freaking zipper on the jacket. And you just like, we should have been out of the house like 15 minutes ago. And now it's going to take 10 more extra minutes until you close that zipper. I just want to do it for you. Just like, get here and let me do it. But oh my God, just standing back like, you're doing great.
Yeah.
Keep doing. Keep
and
trying.
By the way, this is actually a point where I will say actually the opposite, right? So I would say it depends. It depends. Like if we want to make sure that we're on time, if we want to make sure that like you continue with what you want to do as a parent, then you are deciding. But then like, yes, I can give you the permission to try. I know that you can do it. I know it's going to take forever. So then I'm going to give you 2 minutes. You didn't do it. I'm going to do it for you because we have to go. and I'm leading what I need to be leading, right?
Oh,
I
that's a good
can't
advice, too.
I can't always follow my kid, and I can't always follow whatever they want to do, because now they are dictating everything that we're doing. And you know what? That's also not true. That's also, this is actually, if we're talking about it, this is 90% of why people come to me is where your child is the one that runs the show. And the child is the one that, if we're looking at the family structure, and we're supposed to look at like the two parents standing equally at the top, and the child is kind of like on the bottom, in a very clear way of looking at that structure. Now the child is on top, and the parents are reacting to the child, and that's when they come to me. And they don't know what happened, and they don't know how to regulate their child, and they don't know how to, to work on their behavioral problems and all of that. But it's because we are reacting. And what I do in treatment is to bring them back to, wait a second, you are on top. And the thing is that it's not just that, it's also, this is what will help your child to feel less anxious. Because when we give so much power to a child, it doesn't know what to do with this power. It's so overwhelming. And so the child feels overwhelmed. The child doesn't know what to do with all of this. And then they react in a way that is, misbehaving in a way, right? But when we are helping them to put them in some boundaries and some limitations and things that are very predictable, and showing them the way, right? Showing them that this is what we're doing no matter what. And this is how the house functions. And I am the one that is going to be, on top. And you're here. Then the child feels actually like, then they strive.
Right. Because they know their place in the world, and they know that you're, at the end of the day, going to be that safety net for them. You're going to be calling the shots ultimately. But I totally agree with that.
I heard this once from a pediatrician who said it's important to give the child choices, but it's also important to give them choices in a frame.
Yes,
so
exactly that.
It's raining outside, so we're going to put a jacket on. Yeah. That's my decision as your mother.
Exactly.
And there's no discussion about this. You can choose if you want the red or the blue jacket.
100%.
But you're going to put a jacket on. It's not like, it's a cold outside. Do you think you should wear a jacket?
Exactly.
No.
Exactly.
It's like, I'm doing the big decision here because I'm responsible for your health and for your well-being and everything. And there's no question that we put a jacket on. But you have also a saying.
Exactly.
In this frame, which jacket do you want?
I love that.
Me too.
I love that. And I just did it yesterday. With this exactly. So I love this example. It's amazing. And that's what I always teach parents. And yeah, I did it with my son yesterday. He was wearing short sleeves, and I told him, like, hey, you need to wear a jacket. Do you want, do you want the hoodie, or do you want with a zipper? And then he needs to choose from that. So there's no yes or no. That's a big deal. There's no yes or no. It's yes, you're doing that. I'm leading you, and I'm going to be the one standing behind it. And then with that frame, you choose.
Yeah. So much. There's so much on us parents, on us mothers.
I know.
What to do right, what to do wrong, it's hard. Yeah, it's hard. So we need to support each other better.
For sure.
Yeah. We need to give each other and ourselves more grace.
So what are you working on now? Is your specialty with mothers more or younger children more?
So with all my experience, it led me to be working more with kids and families, less with mothers, even though I would really want, because again, like I'm very passionate about it, and I would really want to go back to work with that population more. But right now, I'm working mainly with kids and families, and I do parenting sessions and kids, and my specialty is anxiety and OCD, actually. So I work with young adults as well, and teenagers, and whoever is going through that. So then I help them.
Well, I always have my two favorite questions to ask. Maybe we just choose one or you choose one. But my two favorite questions are, what is the message that you want people to take away from the 2 hours they just invested? And then the other question is, what obstacle are you most proud of overcoming?
Definitely the message that I want everyone to think about is that you can do it. Yes. And be there 100%. And just, if you said that you're going to do something, do it, right? For yourself. Because if you really determine on something, right? So if we're thinking about like what I went through with my life, I kept telling myself, okay, this is the goal. This is what I want to do next. This is, I heard that lady saying something. Great. Now it's my goal. Now I'm going to do it. If I know that I want to pursue my career, I have to start now, because otherwise, who knows what will happen when I'm a parent, right? So if you know that you want to do something, do it. Right. And the rest will follow. And definitely what I said before about this 100%. So then if you decided and you are there, be there 100%. Give it your best. Right. And yeah, I don't know, the biggest obstacle. It's a good question. I think it's, from this conversation, I can definitely say that it's just being far from home, doing everything myself, with this guilt, with this pressure, with this feeling in the back of my mind that like, am I okay? Is that okay that I'm doing that? But to trust yourself and to trust that this is, like that's basically what you said. Like, this is your life, and you make the best of it, and you do whatever is good to you, and the rest will follow.
A message of hope and faith. And I love that when you were sharing the thing about doing it 100%, you were touching your wedding ring. Yes, right. I totally noticed that. That's really sweet.
So shout out to your husband.
Yeah.
That was a great advice.
Really good advice.
Yeah. Thank you for sharing your story.
Thank you. Thank you for having me.
So I unloaded in this episode about
rightfully so
about motherhood.
I mean,
about giving birth.
It was a little bit of a motherhood montage, but
oh yeah,
it needed to be. I mean, this is a traumatic thing that happens, and we don't talk about it. We're like ashamed to say like how awful it can be.
Yeah.
I'm glad that you got your counseling, your free counseling session.
I know, I was like, oh my God. Yeah, while we on it, let me just say, yeah, there could be so many changes. It's such a difficult topic though, because it's also so different for everybody. It's not traumatic and bad for everybody. I mean, so many people really have
beautiful, easy,
magical situations, and then they have this positive rush of hormones through their body, and they're the happiest they've ever been, and all these things.
Right.
So it's everybody's story is so different.
I never thought about it before, just listening to you girls chat, but it occurred to me how crazy it is, because you do fall under this spell of it's beautiful to become a mother and all these things. But when you kind of step away from it, and for me, that moment was listening to you girls talk about your experiences, it occurred to me like the act of giving birth itself and what it does to your body is like being in a car accident, but a huge one with like semi trucks. Like the pain and the trauma and the chaos that your body goes through. And then to think about being in this major head-on collision with a semi-truck, and then that semi-truck, somehow the thing that caused the accident is like put on you, and you're like, but you have to keep it alive now. And you can't even heal from your car accident, your head-on collision with a semi-truck. It's like, here you go.
Right?
Here's your present for being in a car accident. Now you have to feed it and bathe it.
Now go home.
Wipe its butt. Like, it is crazy. That was my vent session.
No, but that's a good comparison. It's exactly like that. Your body is like completely destroyed, and then they give you a baby, and you go like, go home with this now, take care of it.
And then like
you've never done this before? Like you don't know what to do? Whatever, you figure it out. Bye.
And you have to love this thing that just did this to you and wrecked your body, and now you're can't control your own body. Things are happening to your body you didn't know could happen. But you have to love this thing anyway. And I don't know, it just...
Gosh, we love motherhood.
It was just kind of a crazy...
Just like people outside was like, whoa, they really hate being moms. No, that's not what it is. I want to make this clear. This is not what it is. I just feel like we need to give room and space for all the feelings that everybody has.
Mm-hmm.
It doesn't mean we hate motherhood.
Right.
Doesn't mean, I mean, sometimes, a lot of times I hate motherhood. Doesn't mean we hate our children, but it's a lot.
It's a lot.
In the beginning, a friend of mine sent me an article, which I thought summed it up very nice, which said, I love my child, but I hate motherhood.
Mm-hmm.
Did I say that already? Did I talk about that already? I don't remember if I just thought it out or if I said it. And I thought, yeah, that's kind of what it is.
Mm-hmm. Or even if you love your child and you love motherhood, like there can be moments that are so hard to wrap your brain around. And yeah, we do just need to give ourselves space to have those moments.
And like Adi said, with everything else, it's okay. Like you love your job, but you're also allowed to vent about it. You love your husband, but you're also allowed to vent about it with your friends.
Yeah.
When it comes to children or motherhood, there's this weird thing that, ooh, she said something bad about her children, or she said something bad about motherhood. What a bad mother.
Right.
There's this weird thing that we kind of like have to love it all the time. Or the thing that we always have to put at the end of the front of the sentence.
Yes.
I love my child, but. Or say like, oh my God, this was so horrible, but I love my child. It's like
the disclaimer of like, oh, but I love my child.
Because somebody could question it.
Right.
It's just like, why do you have to do that? Why do you have to say that?
And I agree.
Why do you even care if somebody's questioning it? It's like, then question it.
Well, in this space, we allow people to say, I hate being a mom today. This is the last thing I want to do today.
Exactly. And that's okay.
Yeah.
You can hate everything, even the best job in the world. When you get your dream job and you do it, I don't know, for months or years or whatever, you are allowed to hate it sometimes, even though it's your dream job.
And you get burnout from it, even if it's your dream job and you need to go on vacation, recharge.
And it's the same with your husband, and it's the same with your children.
Or your pets.
I don't hate my pets ever.
They haven't peed on your rugs enough.
Oh, that's true. If you think about it, I love my cats unconditionally.
Yeah.
Always.
They're the only ones that get your love.
Whatever they do, they can wake me up 5 times at night. I still don't hate them. If my daughter would wake me up 5 times at night, I would freak.
That's funny.
I wouldn't hate her, but I would freak out on her.
Huh.
And when my cute little cat comes up, wants me to open the blanket and like come under and like cuddle.
You don't mind.
Oh, heaven.
That's funny.
Maybe
we should explore this.
I should be the childless cat lady, I think.
Just have a lot of cats.
Yeah, just have like 18 cats and like be that weird.
That's the only unconditional love that you have is for cats.
For my cat.
I have 0. So at least you have it for something.
Have 0.
Apparently.
What about for me?
Yeah, for you, obviously.
So far, give me a few more years and they're going to be a moment. Just like,
Maybe honey bunny.
Honey bunny.
All right, well.
Okay, good. That's it for today?
I think so. I hope people liked the episode. I hope they liked Adi's story as much as we did. Hope it was helpful for them to know it's okay to have space. And I do want to end with my favorite takeaway from Addie was, if you're going to do something, do it 100%. I love that. I'm going to use that.
Yeah, that was a very good one from her husband.
Yeah.
Like, if you're here, be here.
Yeah.
I love that too.
All right.
Okay.
See you next time, friends.
Bye.